quite lucky in terms of our project in the fact that we see our consumers every single day, for most of them, if not a couple of times a week or weekly. It's been incredibly important for the project that we have a consumer rep on there. They have lived experience about what their condition involves, what their health needs are, and as health professionals sometimes we aren't able to see that properly. The value of having a consumer rep on your team when it comes to these projects is that you have the lived experience of someone who's going through it without the lens of sometimes a bit of a biased health professional take on what we think the problem is. And it really hones down what the importance is for the patient if you really want to make it a patient-centred quality improvement project. As a health professional, we quite often will place a bit of a health professional lens about what we think is best for the patient. I think having Ali on there meant that we could gain a different perspective of life lived experience and what mattered to her, what mattered to our clients, what mattered to them is very different from what we want as outcomes for a patient. When we first started out in the project, we were expecting to have great physical health outcomes because that was the original thing that we applied for the whakatahi for. What ended up happening, having Ali's experience, was we found there were quite a few system failures or system inadequacies that made it very difficult for them to achieve physical health outcomes. So it became very much about tailoring it from the physical health needs of individual patients to maybe trying to systemically change how outcomes are for everybody involved within the methadone program.